Angelo, and I'm from Transcend Wellness London, based in Kingston. So, reason for the video is I'm here to talk to you about hyperbaric oxygen therapy and its benefits and upsides, downsides. So, using our partners at Answer the Public, I've got 21 questions here that are typically Googled around the world about hyperbaric oxygen and what to expect from it. So what the plan is here is to read off the question and give you the shortest, sweetest answer in order to keep this video as short as possible. So if I just get straight off into it, what is hyperbaric oxygen? So hyperbaric oxygen is the process of breathing virtually 100% oxygen in a pressurized pod so that you can actually absorb a lot more of it than you otherwise would. If you just breathed it in normally here out of a cylinder, you wouldn't accept as much as you would as if you go under a slight bit of pressure. That is the key to it. And with this process, it's used for a great many things, which I'm sure we're going to get into in a minute. Is hyperbaric oxygen safe? In a short answer is yes, it is. If it wasn't, I suppose they wouldn't be approved globally for us to be able to use them. Are they dangerous? No, they're not dangerous. There can be some reasons why not to use them, which we'll get into later, but as a whole, no, they're not dangerous. How much do they cost? Typically around £15,000, I think you can buy a chamber for. You can get them, you can actually rent them, but you can probably get them a little bit cheaper, and we actually can provide anyone that wants to buy their own chamber for home use, whether it's either rental or to purchase. We can actually put you in touch with the right people if you want to go down that route. Next question is, does it help dementia? So when I actually checked this on the internet, they've got rather a kind of curious answer really. They don't say yes, although it does seem to be yes. So they actually say HBOT has been found to improve attention, information processing speed and executive function, which normally decline with aging. These improvements in the cognition have now been demonstrated for dementia syndromes, in particular vascular dementia. So what they say, they don't want to seem to say yes, but although HBOT will help with all of the symptoms of dementia. So I'll call that an answer. Can it help with long COVID? Yes, it can. By raising your immune system. One of the things that hyperbaric oxygen does is raise your immune system, and it's useful for not just for long COVID, but also people that are using chemotherapy. And I'm going to get into that a little bit further down the line here because it's a question further down. So short answer is yes, it can help with long COVID. Can they help with stroke victims? Yes, and the key here is, like when you have a stroke or someone has a stroke, the key to getting to a hospital, getting treatment, is time is of the essence. And even after, when you've been discharged, I'd say if it was myself that had a stroke, getting to a hyperbaric oxygen therapy station would be my next priority. As you know, you get an embolism in your brain. The quickest way you can heal this up, the more chance of you're going to have of not losing any function, memory, or physical attributes. Hyperbaric oxygen does a lot of things. Healing up wounds, including the brain, internally and externally, is key, so get in there fast. Can it help with tinnitus? Yes, it can, because tinnitus is an inner ear problem whereby your inner ear is inflamed, and using hyperbaric oxygen therapy actually reduces inflammation and helps with healing, so it can help with it, although you would want to be a little bit careful, because at the same time as helping it, you will receive some pressure on your ears. So providing you can actually pressurize safely and comfortably, it would help. How do they work? So by breathing nearly 100% oxygen under pressure, it makes your body, the pressure actually makes your lungs kind of expand, not so that you would notice, but the pressure would make your body accept way more of the oxygen than you would otherwise be able to accept. So you would actually be carrying around 400% more oxygen in your body after a treatment than you would otherwise be carrying. And as we know, oxygen is something that our bodies use to heal up. So by giving yourself more of it, you can accelerate your healing times by about a third, I think the book says on it. Can it be done at home? Yes, if you have your own, it can safely be done at home, and you've had the training on how to compress and decompress safely, you can do it at home. So, can it be done at home? Can it lower blood pressure? Yes, it can. By producing oxygen in your system, loading your red blood cells and your blood plasma with oxygen, it actually will lower blood pressure. Can it help with cancer? So this is a moot point. I suppose the best way of answering it is no, HBOT will not cure cancer. However, if you're receiving cancer treatment in the form of radiotherapy or chemotherapy, HBOT can help you around that. Chemotherapy typically knocks your immune system, and as I mentioned earlier, HBOT raises your immune system. So we get a lot of patients coming in here that are undergoing chemotherapy. They'll typically come in the day before they're due to go for their chemo, and they'll, with a view to raise their immune system, then they go in, they have their chemo, and it knocks their immune system. And they're in this constant flip-flap of trying to raise it, knock it. But without it, you would be getting knocked down and down and down. And unfortunately, that's how some people lose their battle with cancer, but mainly as a result of the chemotherapy that they've been receiving. So that's that. Can it cause serious? Can it cause seizures? Answer that is not typically. I checked out on the book price on the internet, and what's been listed as you have got a 0.006% chance of it inducing a seizure in someone that would not typically have seizures. If you are prone to seizures, obviously let your HBOT person like me or whoever it is you're having done, let them know that they can expect that, to keep a closer eye on you than they would a normal patient, so that you're not having a seizure whilst under there. Although they can come and go as they would in normal atmospheres, and you can be fine with it. So, can it damage your ears? If it's used incorrectly, you could, but as long as you adhere to the rules and you can equalise, so you can actually hold your nose, pop and equalise, then you should be fine going through the process. I think they've mentioned before, for patients that are unconscious, I think this is in hospitals and stuff, where they're asleep so they're not equalising, it can cause more problems, but as long as you adhere to that. What does it cost? Here, £78 is the price of an hour's long session for HBOT, and that would be an hour's under pressure. So it would take you typically 7 minutes to become under pressure, then you'd have your hour, and then it would be sort of 4 minutes or 5 minutes to decompress you. So you have an hour under pressure. What does it do? Well, typically it does a great many things. There's probably about 150, I think, listed ailments or conditions that HBOT can help with. Obviously, I don't have time to go into them all now, but if anyone's got any questions, please, I don't know, email me or whatever, message me. I'm happy to talk to you about each one individually. What is it good for? Okay, well, same sort of thing. So things like obviously chemo, as I've mentioned, autoimmune conditions, wound healing, diabetes, sort of to name a few, you could expect. So I've got a few more here on the screen. Can you use it when you're sick? It's actually not recommended, although sick is a broad term. Also, you'll be coming in because you have something potentially wrong with you. The main problem here is having it so that you can actually equalise. So if you've got a cold or flu or something like that, it's not recommended because your sinuses will be blocked, you won't be able to breathe correctly, and it will generally cause more problems than it's solving, and you might not even be able to get under pressure if you can't equalise your ears because you'll just get pressure build up. So but obviously if you've got you're sick with, say, chemo or something like that, then yes, you can use it. Where is it used? Globally. Every single country in the world is using HBOT at the moment at different levels. Why does it work? Well, as I mentioned earlier, some of these questions do repeat. So why does it work? It's the pressure. The bit of pressure you're under makes your body accept way more oxygen than if you just breathed oxygen under a normal conditions under the normal atmosphere. I think I mentioned earlier, we get 21% oxygen out here on the surface of the planet. When you go into a pod or a hyperbaric chamber, you'll be typically getting nearly 100% oxygen. So flooding that into your red blood cells does nothing but good for you. Will it help with COPD? So COPD is one of the contraindications for not using a hyperbaric chamber. However, depending on where you are with it, how bad it is, you can, if you've got permission by a doctor, it will be okay. One of the other contraindications is if you've had a lung collapse or something like that. But if you've had that historically a long time ago, you should be okay with it. I have actually had a patient with COPD, and they had dramatic sort of good effects from going into the chamber in terms of like improved energy and movement, but it didn't last. I think typically she felt great for about 5 hours, then it started to dip off again, and unfortunately she wasn't local, so she couldn't keep coming back. So that's actually got to the end of my answers. So as I said, Angelo at Transcend Wellness London in Kingston. If there's anything more that you need to know, feel free to get in touch. We're right in the heart of Kingston, so come and give us a try. We've got memberships available that are newly out, so we can actually accommodate different price points depending on what treatments you need and how you want to receive them. Thank you.